Welcome to the Sultans of Sales podcast. I'm your host, Jamil Pendleton. My friends call me Jay. Thank you so much for tuning in. Today on the show, we have a special guest, Dr. Michael Venezia. He's practicing medicine, orthopedic spine surgeon in Clearwater, Florida, just outside of Tampa. Dr. Venezia, thank you so much for taking time. Welcome to the show.
Thanks, Jay. Thanks for having me. This is great.
Yeah, no, it's awesome. And we've connected through social media. So maybe there's an opportunity to discuss that.
Story of life now in 2021, where everyone connects online.
It is. It's interesting though, because I think like we've talked a few times on the phone, and having the opportunity to do this podcast is something I really wanted to learn about you, and given the fact that you're recent in your 15 months into the journey. So tell the audience, if you will, where you came from, where you went to school, just kind of give them a feel for you, and we'll kick it from there.
Sure. Yeah. So I'm a born and raised Floridian. So I'm back home practicing. I did my undergraduate at University of Central Florida in Orlando. And then I did a master's in public health over at Nova Southeastern, kind of a bridgeway into medicine. And then did my medical training at LECOM in Sarasota, a private school over in Sarasota, Florida. So kind of stayed in my little triangle of Florida.
Right.
Did my residency training at USF community program over in Tampa, kind of Clearwater area. Kind of how I got to know the area. Spent 5 years here, and then was lucky enough to get over to San Francisco to UCSF for my training in complex spine, and then came back home.
That's awesome. And I saw you. I think you posted about Dr. Devrin. Was he your?
Yeah.
That's awesome.
Oh yeah, yeah. Vidot's one of my heroes. He's one of my mentors. He's a great guy.
And so, what was that like? I mean, UCSF is such a name, and it's got such a great reputation. But I mean, you were there recently, and I just would love to hear from your perspective, kind of your experience as a fellow at UCSF.
Yeah, no, it was a really, really cool year. I mean, what drew me to the program was obviously some of these guys that are just like titans of the industry that have just, extremely well known, and training at more of a community type residency program. Got my hands dirty early, but I didn't get to do a lot of that complex stuff. And so I knew I wanted a complete training. So I was like, these guys are just doing it all.
Sure.
And it's such a great mix of people. You've got Vidot Devrin, who's one of the busiest deformity surgeons in the country. And you've got Sig Berber, who's one of the most well-known spine surgeons in the country. You've got Bobby Tay, who does a lot of cervical stuff. And then you've got Shane Birch, who is just a huge innovator in tech and really pushing the limits on navigation and all that stuff. So it was just such a great combination. Sure, it's definitely an intimidating year, every Monday morning you had conference as a fellow and you're presenting it all, which was, it's a great learning experience, just a complete 24/7. You're always figuring something out. And, just getting to like a full breadth of experience was great there. It was an interesting year because it hit during COVID. So
yes,
March 19, it was, I guess, or March of 20.
March 20.
Right. Yeah, March of 2020, when we were getting towards the end of our fellowship, that all kind of hit. So we went through like a 6-week lull, where nobody's doing anything. Luckily, as a tertiary referral center, the book started piling up, and they just said, okay, well, you guys can get back to work. But there definitely was a weird paradigm shift where now we're, doing clinics. Everything was telehealth, and it was such a strange thing to kind of, you're learning spine surgery, you're learning how to treat patients and how to diagnose these complex problems. And now you're learning how to do it via telehealth. And it's just like, it was just a different world. I think all of us, the 19 to 20 fellows, really had it was such a pivot where you went from figuring out what you're going to do in your own practice, and you're at the tail end, and now you've got to figure out this whole new way of practicing medicine almost. So it was,
sorry to interrupt. Keep going.
No. Yeah.
Oh, I was just going to say, what an opportune time to learn where things went in 2021 or are going, kind of this digital transformation. And you can speak to the telehealth, but I mean, I think there's so many ways to take that, maybe fortuitous for you in private practice now in Clearwater. I mean, I don't know. I don't want to put that in your mouth, but
no, I think that's totally correct. I think there's a ton of people that now they're thinking, oh, if I don't have to leave my home office, if you don't need to see me, if we've already had an initial consultation, you're just reviewing an MRI with me, well, what can we do that, in the office? And there isn't a good reason why we can't, right?
Right.
A lot of this stuff. So I think it really has forced us to take a step back and look at, the way we practice medicine and, how to make this more efficient even, because telehealth can, if done correctly, they can be efficient in clinic. And, you've got, private practice, you've got to see enough people. You're not going to be at UCSF and you're not going to see 10 out of 10 are surgical patients. And you're just figuring out what surgery to do.
Yeah.
I see a lot of back pain,
Yes.
So people that'll never need surgery, right? It's just the life of a private practice community surgeon. Right?
Absolutely. Well, but that's interesting. And it's one of the things that we talked about that I wanted to touch on is your experience moving from that large teaching institution environment to the private practice environment where, there's, I'm sure very, very competitive, South Florida, Florida in general, and so kind of what have you learned? I know it's early in your journey, but
yeah. Florida's an interesting market because it's the king of MIS spine surgery. It's the the home of Laser Spine Institute. Rest in peace.
That's right.
But
who did as many fusions and everything else as anyone? It's just the marketing angle of laser.
Probably more.
Yeah.
So every single patient in this area, they know all these gimmicky terms, laser spine surgery, MIS surgery. So you've got to market yourself in the right thing for these people, but also you've got to be in this new world where the patients know these procedures and they know what's going on around them, and they think they know at least, and some of it is kind of misleading marketing. You have to figure out a way to dance around that as well, which is an interesting world. And then there's just a lot of really good surgeons in the area. It's a great place to live. We're blessed to be here. But it's a different road for sure. Like figuring out how to become busy again, where, you come from an academic center where they can't see enough people and it just keeps coming. And you've got to figure out how to build your referral network, which has been, an ever learning experience. I feel like every time I have a short day, I'm bringing donuts to the office girls and all the primary care doctors,
that's right,
pain management doctors, whatever you can do. And, you take what you can get from them, and they appreciate your help, but they don't know which patients need surgery and which don't. So you end up seeing, you end up seeing a lot of things that will never need surgery, but that's just part of being in this type of community, right?
Totally.
So, and then it's like, yeah, go ahead.
No. Please continue.
No, it's just, I realized early on, it's like I was thinking as I was leaving fellowship, it's like, how do you've got to figure out a niche for yourself almost, right? You've got to figure out a way to market yourself. Everybody can do a good job with surgery and taking care of these patients. And you've got a lot of people that have been here for decades and have a well-known name. So how do you establish yourself as a new guy on the practice and not just rely on, oh, my partners are going to give me some patients and it's just how things are going to work. And eventually I'll get busy. And it just doesn't work that way.
No, it doesn't. No, just thinking about just the kind of where you are, this inflection point of technology, of digital. You mentioned telehealth, right? Social media, these new means of communication, just like you and I have never met. We're gathering, right? And this won't be the last. Like we're gonna have a relationship. And for your patients, and I've talked about this, Dr. Chet Donnelly before.
Yeah, I know Chet well.
yeah, that's what he said. Yeah, he seems to really get and clue in on the fact that, look, this is all a way to market yourself to your patient population, to your community, right? And there's different means for it. And we discussed this at length on his podcast. It's just about how if you're in plastics or you're in other things, maybe Instagram or TikTok, but I mean, for surgeons, I mean, the patients are going to find you. To your point, they're going to do their homework based on their research. They may already know some of the terms for these procedures, right? And think they know what they need. And so I just think about like where you are today, starting out, 50, you're a year plus in, but you've seen kind of the one example or the one extreme, if you will, of the large teaching institution. And then now you're there trying to, as you said, differentiate yourself, your practice for your patients. And I think it's just what an exciting time, right? With technology on the rise and kind of these new innovative ways to treat your patients.
Right. Yeah, no, it's been exciting, but like challenging as well. It's like you want to introduce new things. towards the end of my fellowship, I got to spend some time with Luis Pimenta and with Dr. Devrin, and learn the prone lateral technique. And I was like, this just makes sense. Like in my head, figuring a way, I've got an elderly population, I can get them off the table faster and do just as good of a surgery if I don't have to reposition these patients. Because UCSF, we were big believers in anterior column reconstruction and sagittal alignment. And, it's kind of ingrained in you that all this stuff matters, and every patient is a deformity patient. Right. So, the procedure just made sense to me. And so I brought that to my hospital. They'd never seen anything like this before. They've done a few laterals here and there. So it's like introducing a whole new way of doing things as the new guy. And then they're like, well, is this guy any good? Like, is he slow? Like, is he gonna keep us there after 3 o'clock? Like, all this stuff's going through their head. And it's like a whole different paradigm, because they don't see outcomes, right? They see, is he a nice guy in the OR? And is he fast?
Right.
That's, do I want to work with him? And does he keep me in the OR all day, is what they really see. So,
sure.
You have that added pressure of like, you're the newest surgeon at a hospital, and like, you've got a small window for them to trust you. And so you want to do a good job. You want to pick the right people. You want to have good outcomes, and then you want to make sure everybody around you likes you, and that they want to work with you. And so there's just so much of a balancing act to becoming a successful like private practice surgeon. I'm a long way from that, right? But it's a uphill battle.
Well, and so there's so much there. I kind of love the uphill battle that you mentioned, and having to, you mentioned earlier about the primary care, the referral network, and then differentiating yourself from your patients. This podcast started as the Sultans of Spine, and then we kind of widened the lens to include sales. But spine surgeons, you're selling yourself. You're selling what you can do for your patients, right? So, I mean, I think it still works. In large part because, golly, that's just such a really interesting, place. And sometimes you may have experienced this when you are the new guy, you can ask for all the new things because there's no baseline. There's nothing to compare to. This is what I need.
Right. 100%.
That kind of dives into that question I wanted to ask. Like, what enabling technologies are you excited about? I mean, obviously PTP, prone lateral. I just kind of wanted to hear from you. You've seen a lot of the latest stuff, but just what are your thoughts on kind of what's next?
Yeah, no, I mean, I think spine surgery itself is such an exciting field, as we talked about. It's like there's something new that's being developed every minute. And, we're just so far away. I think that's what kind of drove me into spine from orthopedics. It's like, hips and knees, we've done a pretty good job with hips and knee replacements, right? Like we've kind of hit the pinnacle. We've hit Mount Everest. The prostheses last a long time. They have great outcomes. Whereas in spine surgery, we just have so much more that we can be doing better. And, this whole in vogue of minimally invasive surgery. I mean, it's how we were all trained, as our young guys coming up, but it means so many different things to so many different people, but it's like, it's really a mindset, right? It starts from, day one of looking at the pathology and figuring out what we can fix, what we don't need to fix, what's important to include and what's not important to include in a construct. Do they need a construct? Do they just need a decompression, right? Can it be done in even a smaller, minimally invasive fashion? There's endoscopic surgery, which I know you've talked to some of the guys that are really big in the country doing that stuff, and it's phenomenal. I'm hoping to learn that myself here soon. We didn't do a lot of it at UCSF, so but nice. Just figuring out new ways to do things, and then including technology. I think we're at that kind of point in spine surgery where it's almost like you need to be including these navigating technology procedures, and whether it be robotics or intraoperative navigation. There's almost no reason why not to include these type of procedures in your workflow, because we're getting to the point where, there's almost no excuse to have a misplaced pedicle screw anymore, right? It's almost to the point where, sure, all of us can freehand pedicle screws, but now we have all this technology. I got a chance to train with Shane Birch, who is a huge Medtronic guy, and he spent 10 years with Stealth, and now he's to the point where it's almost been perfected. And he talks about the uphill battle of teaching even the UCSF people of how to use the O-arm, how to use Stealth, but getting through it because it's better for the patient, it's better for the staff, less radiation. I mean, there's just a lot of things that we didn't really even think about back in the day before I was practicing medicine, that now we have ways around and we have better fixes for it. So I think that's all really exciting. So I tend to use a lot of navigation in my procedures if I can. I love the idea of single position surgery. It just makes sense to me, right? Like I think on top of minimally invasive, we try to do less to the tissues. We try to get these people home faster, have less pain, but still accomplish our goals.
Yes.
And then you have the other side where we try to keep them to where they're spending less time under anesthesia. So it just, the flip on a lateral surgery, which I love lateral procedures. I think it's just a phenomenal procedure for obtaining our goals of fusion and alignment. But it also has that added downtime that the patient is asleep. I mean,
right.
So that exposes you to anesthetic risks and things like that. So I think it's just awesome that we're developing ways to narrow that down. And then for me, thinking about sagittal alignment, like prone lateral just made sense. So I'm very excited about that. And I kind of combine that with navigation in a lot of my procedures when I can. So I think that, the future is bright for, figuring out where we can go from here. Robotics definitely has its place. I think that it's got a long way to go as well. And it's got the sky's the limit for it, right? I mean, we're so far from hitting the point to where, all these technologies have been appropriately integrated, and I think I'm just excited to see where this is going to go in the future. And it's almost like you have to struggle a little bit through some of the early hoops that we're jumping through to use this stuff, because it's sometimes easier just to bring in a fluoro C-arm and put screws in, but it's struggling figuring out the workflow has been a challenge, but it's cool to see the outcomes.
Yes. In you having your training where you had it, as you mentioned, how to place a freehand pedicle screw, and therefore you can appreciate, right, these assisted technologies, robotic or navigated or what have you, power. It was really, really interesting. It was actually in Florida, ironically, I think 2018 Solus, back when that was still happening, the conference. And, there's a really good debate. I wish that there's a video recording of this, because it was fascinating. The discussion was, are we harming tomorrow's surgeons by basically, teaching them these ways of navigation and robotics, and to which, if that machine's down, they can't operate, they can't place the screw, or they don't feel like they could do it as well. So what are your thoughts on that debate? Because it's real.
No, I've heard the debate that you're referring to in some different form, but it's definitely a real concern, right? I think that these technologies enable surgeons to be better at what they do, right? They give us more tools to work with, but no, there are times that it doesn't work. And I had a case where I navigated it in, and the intraoperative navigation wasn't working, so we had to bail and do a freehand technique, which it happens. So I agree. I think that we've reached a precipice to where the training needs to be all encompassing. I think you still need to learn the right ways to do things, but we have so much. Spine is so lucky because we have all the help from tech, right? We have all the help from the industry that, if you say, oh, I want my fellows to learn how to put freehand screws, you've got 4 companies ready to help out and learn and teach and allow a space for them to learn. So I think we have opportunities still to do that, and we don't necessarily need to do it on live patients anymore, right? So I think that, there's always going to be that time where we don't use navigation or we don't use technology and stuff. So, or we need to bail out to something else. And I think having a knowledge of anatomy, I think, is the core of what we do as orthopedic surgeons and then as spine surgeons. So I think you can't forget where you came from, right? That's right. But I think Dr. Bergeron would agree with that. But it's just it's going to be tough, I think, as we continue to go on. I think even in our timing as being young surgeons, it's like there's still a lot of people that have not adopted some of this tech yet. So you're still getting a little bit of a mixed education when you're in fellowship, which is phenomenal. But as we go down the line, I do see 10 years from now, maybe where's spine surgery going, and like that could be a problem in the future.
Yeah, that was one of the questions, I think, is like, where do you see, 2027? Like, let's just kind of put a random date on there. It's not that far away.
Yeah,
it's 5 years away, right?
Yeah.
We're here. 2022 is
a couple of days. Yeah.
Yeah. Right. But So in 5 years, I mean, because again, looking back 5 years ago, right, to where we are today, incredible growth in terms of the technology, the approaches, the different ways in which you all can treat the pathologies that you see. But what do you think? I mean, is it incremental growth? Is there going to be some big thing? I mean, I'm just curious on your perspective.
Yeah, some of the stuff that I think I'm excited for, especially coming from UCSF and seeing like Vedant Devran and Chris Ames and these guys look so into like AI.
Yes.
And I think we're going to be able to learn a lot more about ourselves as surgeons. Some of it may not be good, right? We may learn about, the surgeons who are doing that may be doomed to fail from the start. I think that as data gets better and we figure out, what populations benefit from what types of surgeries, because when I trained at a place where we did a lot of deformity, a lot of osteotomies and big procedures that are expensive. They're a huge cost to the hospital. Implants are costly, and then if you have one of those that fail, revisions are extremely costly. So if we're looking at which, I think we're going to get better at figuring out which patients will succeed in this type of surgery. I think we'll kind of learn from ourselves almost. I think as data starts to build. And then I think we're going to see a lot of a shift looking at implants, I think, to more customized implants based on, bone density scans, things like that, to help prevent these problems that we deal with in spine surgery from happening. Awesome. I hope to see we get even better with minimally invasive surgery. People going home faster because we're figuring out ways for them to have less pain after surgery because we're doing it without so much soft tissue disruption, or we're using the right cocktails for them to go home without significant amount of pain. Hopefully figuring out that kind of stuff, I think will really have a big paradigm shift. In 2020 has really kind of pushed us that way. ASCs are more accepted to do fusions and larger procedures because people don't want to go to the hospital. That was like my first year out, is my first year being a COVID year. Nobody wants surgery. I mean, I can't count the number of people that I would come in and see for issues that were surgical and they had no desire to have surgery. And they tell you that from the start. And you're like, well, I'm the spine surgeon. It's nice to meet you, here to help.
Right. Just here to help. Oh my goodness.
Yeah. So it's been such a shift that we're seeing, not only in tech, but in, where people want to have surgery. And obviously the hospital in spine surgery still has a huge place for the surgeries we perform. There's just a lot that we can't do in an ASC, but we're starting to see that be more normalized for these smaller procedures, which I think is great because I think it's a great option for patients to have as well.
No, I would agree. No, well said. So in terms of like how you market that though, I mean, we dabbled, we talked a little bit about social media and kind of, you're there, private practice. Is that something that you're working on that keeps you up at night? I mean, is it just kind of one of those things? I mean,
I think we chatted about this briefly offline, is that, and we talked about, you had Chet on and he's just the sultan of social media, right? The guy just knows what he's doing. But no, I mean, I've definitely like developed some platform that I'm trying to work on figuring out how to best market, right? And it's just such a different world having to market yourself and figuring out what the best way to do that is, right? Do you present cases, or do you show off patient reviews and things like that? It's just what's the best way to show yourself as a new and up and coming surgeon, to differentiate yourself. But I think it's a necessary thing. I mean, I think it's such a cool platform too, because I've gotten involved in a lot of chats, like discussions, which is super great. You've got colleagues from around the country that you're able to, have discussions with and bounce cases off even, and see, what they would have done and that sort of thing. So I think that's such a cool environment to have, and something that I think definitely COVID has kind of spawned. I think we'd all agree that social media has just had a huge uptick in all aspects of life. So I think it's become something that we need to use, and learning how to use it in the right manner is, for me, it's definitely been a learning process.
Yeah. And I think the manner in which is very important. One of the things I learned from Peter Durman was know your audience. I think he very specifically markets himself for things that patients will eventually consume. And so it's all about what happens before the surgery, right? After, right? What is it? What is the incision? And that's very, very smart on his part to understand that that's his kind of wheelhouse of how to present himself, how to market himself. And he's done a fantastic job, right? Obviously TBI is a big name as well, but I've noticed that about, like, for example, Juan Uribe, where he is in a different stage and working for BNI and does a lot of grand rounds and a lot of, kind of interoperative things. And so his audience is very surgeon heavy, and I would imagine. So it's interesting to think about that.
Yeah.
As you market yourself. And to be honest, I have a lot to learn from that too, in terms of like, who am I marketing to? Right. And so there's just lessons that we learn, throughout the way. So,
yeah, no, I think the platform is just great to have. So, it's something that you can always be learning, right? You don't have to go and have these conversations in person. Like there's just so many opportunities to use social media for not only collegial discussions with fellow surgeons or with industry, which is great. And then you've got the whole patient population that you're marketing to. So, it's here to stay. That's for sure. So,
yeah. One of the cool experiences that I got to kind of quasi be a part of was I got a text from a surgeon who said, You'll never believe this. A patient was wheeling in to do, I don't even know what the procedure, I don't need to say it right for HIPAA, whatever, but was rolling in to do a procedure. And he was like, looked at the surgeon who had been on my show. And this was back when it was called the Sultans of Spine. And he looks at him, he's like, you're the Sultan of Spine. And the doctor was like, what? How is this?
Yeah.
If you think about it, it's not that far off. This is a YouTube podcast, right? You Google the name of the surgeon, maybe SEO, I don't know, pops up, and it's a recent, it's just interesting, right? To think about like where these things could go. And so it's just, for me, it's like, why wouldn't you mentioned that about surgery. Why wouldn't you use the latest and greatest technology in surgery, right? If it could help your patients. Well, similarly, if you're a surgeon or if you're anyone and you're looking to market something or get your name right out there or whatever, even if you just want to have a conversation, right, with a ball guy from Texas, it might be beneficial. Like you never know. So
yeah, no, I mean, I feel like everything's a learning process, right? And it's like, that's why we went into this, it's you can never stop learning things in this field, which is great. We've got so much to grow.
Absolutely.
I think the sky's the limit, really. It's pretty cool what the future is going to hold.
No, it's awesome. Well, rounding out, let's if you got time for one or two more questions.
Okay. Funny. Yeah.
I want to be respectful.
No, all good.
So let's talk about your surgical team. So obviously you're in the practice. Like, how have you built that? Is there something that is there a team that you traditionally do surgeries with? I'm not sure of your setup in the OR, but just kind of curious on that. Aspect.
At a community hospital, it's been a learning experience. And then when COVID hits, everyone's short staffed. So I've been sort of lucky where I've had a scrub tech that's kind of been with me from the start. And I think she enjoyed the bigger procedures, and everyone else was like, I don't know if I want to do these.
Yes.
I did a PSO like maybe 3 months into practice, and they hadn't done one in this hospital in probably a decade.
Oh my goodness.
It was a lot to bring at them. And, when you start talking about preoperative protocols and stuff, and you see their eyes get big, they're like, you're in for something, right?
Sure.
So, but no, I mean, the hospital system has been great. It's a equipped hospital system, which I think is super important. Like coming out, you've got to know your hospital's limits, right? So you have to take a hard look at that hospital and be like, can they safely do what I want to do for these patients? If not, then that's not the right place to perform these procedures. So, but I've had a scrub tech, and everything else kind of varies. I lucked out to where my rep that I use for most of my cases is a colleague, a buddy from college that we've known each other forever. So it's a great environment, right? So you've known the guy forever, and it's being in the OR together is it's a lot of fun, right?
Yes,
that's what we love doing. It's like getting in there, and that's the game, right? That's your name's getting called, you're going in. That's where we thrive. So absolutely. It's been a learning experience for sure, but I feel like slowly but surely, I'm starting to build a rapport with the staff, and which has been, it makes these cases just so much easier when they're used to the fact that, you know, you bring in an O-arm every time, and
That's
how
right.
that goes in, and how do you run this stuff, and where the stealth goes. And it's just, when it first starts, it's like, you know, you're 14 dancing with a guy for the first time. So, you know, it's like,
Yeah,
you know, the
yeah,
girl doesn't know what to do, the guy doesn't know what to do. It's just it's an awkward environment, and then you kind of figure each other out, and you know, we've learned a lot together, I think,
That's
over
a
the
great
last
analogy.
year.
Sorry to
But
interrupt.
yeah,
I love that analogy. I just my mind goes to
you
that
can picture the
savoring for the
awkwardness
Holy
of
Ghost.
like a
Yeah,
prom
yeah,
date, just
yeah,
dancing.
yeah. It's amazing, but it's so true. And it's like,
Uh,
I think to your scrub tech, and I've been fortunate to kind of those scrub techs, or those spine junkies, if you will, veterans, that they love the long, big procedures. Maybe it's somewhere that he or she has been in the past, they're traveling or whatever,
right.
and they find it, and they just, that's kind of what they love to do. And
Yeah.
scrub techs are they're so critically important and vital to the just the whole workflow and ecosystem of that room. So, and
Right.
DOR,
100%.
yeah, it's
No,
awesome.
there's nothing like it. That's why we love what we do. Right?
Yeah, it's awesome. It's like a drug, man. I mean, you know, I went through a series of withdrawals when I basically kind of went into management from being that rep in the room every single day, because it's such an undescribable environment, and you get used to it. You kind of get comfortable there, and there's nothing else like it. There's absolutely nothing else like it. So
yeah, I think from the outside, you don't appreciate how much like everyone plays such a vital role. Like, you know, industry especially, it's like, you know, it's so different in spine too. It's like you rely on that guy to provide advice. You know, they know you know their products better than anyone, and you know when to ask for what, and it's key to have everyone on the same page and everybody like wanting to work together, you know. So
that's right.
it's been you know, you learn a lot together, I feel like.
Yes,
which has been cool.
Well, it's just, and thanks for saying that. I mean, it seems like, honestly, I'm not asking, I'm basically interested in your opinion on industry playing a role, and so that's helpful. But you know, just through conversation, a few of these podcasts that I've done, the surgeons are have all kind of had very similar outlook to where you're, I don't want to say vital, but very important part of the team is industry. And
Yeah,
you know, I say that would go against some of those headlines and trends that you read about the repless models and things that
right.
I don't know. I'm an
Yeah,
advocate. Of course, I'm biased, but as a former
yeah,
rep,
no, I think it's a vital role in the operating room, right? Like, you know, especially these big complex surgeries. It's, you know, I mean, I don't even have to think, and I know that my rep's going to have a plan B, C, and he's going to text me and see if I want a plan D. You know, so you know, like, no, that makes you feel so comfortable going to these large surgeries where there's complications and there's lots of risks, and you're already worried enough about getting the appropriate outcome.
That's
You
right.
don't want to have to worry about something else, you know. And it takes a huge burden off of you to focus on, you know, the procedure itself and what needs to be done. So no, I think I mean, a vital role for sure. It's great to, and it has to be the right type of rep, right? You
That's
know,
right.
there's definitely some reps that, you know, don't provide any roles,
Yeah.
and
Yes.
that they don't last very long typically, but especially in the spine industry. But you know, I still take some general orthopedic call, and you know, it's totally different, right?
No,
So
but you mentioned something. Actually, I've talked about this before, and I wanted to just highlight what you said. As a rep, if we can provide that, you know, I had some silly video talking about Chick-fil-A, and bear with me, I'll get somewhere, but I talking
so the
about
Chick-fil-A analogy has got to be good.
yeah. Well, okay. So it's essentially like when you pull up to a Chick-fil-A, the line's out the door. Here in Texas, it's crazy, but I have all the confidence in the world that they're going to get through that line. It's not going to feel nearly as long as the line looks, right, when you roll up.
Right.
And I'm going to botch this, but I had some decent points and analogies here. But essentially, the point is, if you as a rep can be Chick-fil-A for the surgeon, what I mean by that is, like, the surgeon has pathology. gnarly anatomy, just a problem patient. No other cases that day. It's just like, this is it. It is a challenge. If you can just be dialed and prepared and know all those things like A, B, C, D, and F, right? Have them all ready to go and be on your game, right? Not be on your phone, be dialed in, engaged in the procedure to where the surgeon knows that, you know, he or she has an ally in the room and that we're going to be there through it all. And maybe it gives a little bit confidence to take on, you know, those procedures, maybe to do the newer, you know, prone lateral or something on a pathology that maybe you wouldn't have if that rep wasn't going to be there to guide you through it. And I just think that what an honor and what a gift that we get to be part of that, you know, team. And it's something that, you know, I'm always going to be grateful for, having been in the room.
No. Yeah. I mean, I think a lot of us who played sports, right? We know that it's team effort, right? So if you don't have, you can, unless you're Michael Jordan and you want to go out and score 80 points, you know, but like, you know, you need everyone on the same page to win, right? You need everyone invested in the outcome of this patient. It's hard because it's like, you know, some of the, I mean, I've learned that like my scrub tech, and she's awesome. And she'll ask like how these patients are doing. Right. And like, she wants to know, you know, she doesn't get to see them in clinic, and maybe early on, that's a good thing. And then, you know, like later on when they're doing great, it's like, you know, they want to know that you know, they made a difference too. So I found that like, you know, talking to them about like, oh yeah, she's doing great. I mean, I think that was interesting for me to like experience first year out. Like, you know, these people want to be part of it. And like, I think they feel like it's more of an exciting environment if they are part of the whole process. Same thing with our reps.
Absolutely. Those were the best texts that I would receive. I mean, I think absolutely the best kind of messaging, kind of make your day, make your week is like, hey, the patient, remember that patient from Monday or whatever, that, well, they went home on Tylenol, you know, post-op day 2.
Right.
And you're just like, what? Like, this is incredible. Yeah. It's the fulfilling part of the job. It's the part of the job that I'm proud to tell my kids about. It's like, we helped people. And that's what I think is really ultimately. And I know, you know, Pat Miles, you know, he coined that phrase, you know, good surgery is good business. And so if we focus on the surgery and the outcomes will lead to, we don't have to worry about all the business stuff because it takes care of itself.
Right. So, yeah.
That's a really cool, just love to hear about the environment with your scrub tech and then just kind of the room. I could go on and on. I wanted to close. What the last question, this was, I think, number 6, what drives you, or what do you want your legacy to be? I know it's hard because you're just getting into this, but start with the end in mind, maybe. So what?
Yeah, no,
about that.
I've thought about this before. You know, it's tough because, you know, I'm in a small community, and I've learned quickly like how great that is and how much of a burden that is too, in a good way. You know, I want, you know, I think, you know, maybe it's cheesy, but like, you know, I have 2 daughters and a son, and like, you always hear all these old doctors say, I would tell my kids to never go into medicine, but it would be a huge honor if they were like, oh, I watched my dad and like, I want to do medicine. Like, you know, he was respecting the community, you know, took care of the community, and, you know, took care of patients, took care of the people that he cares about. Right. So, you know, being involved in the community and things like that, I think are very important to me. And I love the idea of advancing tech. You know, I'm a private practice guy now. I have nothing, you know, I'm not in an academic center, but I think, you know, I think the future is bright for even in a private practice to learn and adapt and figure out how to advance spine surgery. I think like being able to kind of get us to that next level, I would love to be a part of, right? Whatever that is, you know.
Sure.
No, I think that you know, figuring out you know what I'm going to be. I don't want to say that, but, you know, like, I think, you know, figuring out, you know, like what the legacy is going to be is a good question. I think I would really like, you know, to be, you know, thought of as like one of the respected members of the community, and someone that helped the people that he lives around, that sort of thing. I think it's a huge honor to someone to trust you with that, you know.
It's the biggest trust. I mean, it's what a noble thing, right? To be the caretaker for those patients who I mean, you've been training a large part of your life to this point, and to get to use those tools and the God-given abilities, right? It's it's got to be pretty cool, pretty humbling.
Yeah. No, it's a fun road. It has ups and downs for sure.
Yeah.
But sometimes you feel like you got lost.
Yeah.
But figure your way out of the woods sometimes.
Well, that's life, man. Well, so is there anything you would like to kind of promote or say, or I'll kind of leave the last one up to you? Is there anything, where people could find you? If you want to leave your website, of course, I can include it in the show notes, but just anything at all, I'll kick it over to you. If there's anything you wanted to talk about.
I appreciate you inviting me. This is great. It's such a cool platform to just, be able to discuss what we love. Right. It's one of the reasons why we do this. I love discussing, what people are doing around the country and, advancing, the field we went into. My website, it's clearwaterspinesurgeon.com. I'm trying to start, promoting that. On social media and things like that. So hopefully you'll see some more of that, in the near future, and you've kind of lit a fire in me.
Yeah. I love it.
Yeah, no, I'm excited to, I'm sure we'll connect some more. This was great. I really enjoyed it.
Yeah, no, thanks so much for coming on. I know it's kind of it's a different medium of gathering and kind of hanging out, but for me, it's just so fun to come on, to get to know you and share this to maybe surgeons that are going through their residency or fellowship, right? And they can think about, wow, this is what you were going through, in those first kind of 2 years. And I think that's beneficial, right? Just like it is for the reps or industry that can maybe get something from this conversation. I think that's valuable. So I'm grateful for that.
This was great. Yeah. This is a great idea. So bravo.
Thanks, man. Thanks for coming on the journey along with. I'm going to close out here. Thank you all for joining the Sultans of Sales podcast. This was wonderful. Tune in next week. ClearwaterSpineSurgeon.com. See ya.